Okay, magandang tanghali po sa inyong lahat, and for those who are watching us outside of the Philippines, good morning, good afternoon, good evening po sa inyong lahat. Welcome to the 66th installment of the Stop COVID Deaths webinar series, and we are glad that you are able to join us today and that you continue to spread the word about our credible online community as we bring you more timely and informative topics in our COVID-19 learning journey together. So as the Delta variant of SARS-CoV-2 has really swept across the globe and makes its way to the Philippines, actually nandito na nga po, no? The very first case of the Lambda variant over the weekend po ay na-report. Ang mga katanungan po over the weekend also ay dapat po ba tayong kabahan? Ano po ba ang dapat po naming karagdagang gawin? May iba po bang kaming dapat na gawin bukod po sa mga regular na naming ginagawa? So for today's episode of Stop COVID Deaths, we will give you all of the latest evidence-based information about the COVID-19 variants and an update also about the vaccines. I'm Dr. Raymond Francis Sarmiento from the National Institutes of Health, University of the Philippines, Manila, as Director of the National Telehealth Center. It's a pleasure to be with all of you during our regular Friday lunch date, and always looking forward po in co-hosting this credible online community webinar po natin with my partner and my mentor po, our adjunct research faculty at the National Telehealth Center, and also the Special Envoy of the President for Global Health Initiatives, Dr. Susie Pineda Mercado. Dr. Susie?
Hello Raymond, good afternoon. Magandang hapon po sa inyo lahat. Kung saan man kayo naroon, I hope you're doing okay. I hope you're fine. I hope your families are all okay. This is nga our credible online community, and I think when the Lambda variant news came out, we said, oh, we have to talk about that because it's new. We want to make sure that all of you, our frontliners, have access to really the most credible experts, that somehow meron tayong pang-kontra sa disinformation. And the only way to do that is for us to really be vigilant in sharing the right information, which is what we try to do in this webinar. So I'd like to welcome everyone from all over the Philippines. Natutuwa naman ako, parang nakikilala. So binabati ko kayo yung mga maagang pumapasok. Binabati ko sa chat, ano. So there's a bit of a time, and I really appreciate all those who are regular listeners. If it's not for you, kundi po sa inyo, sa ating audience, wala po kami rito. We are here for you, to serve you, and I hope that today we are going to learn a lot. But we have to start, I think, Raymond, by finding out what people think about this Lambda variant. Go ahead, Raymond.
Thank you so much, Dr. Susie. For those who are watching us, you already know that we are being live streamed sa ating mga social media pages, specifically in the YouTube channel of TVUP, as well as the Facebook pages of the University of the Philippine System, TVUP, and the Stop COVID Deaths Facebook page. So please let us know if you are doing anything of the sort in relation po to the watch parties. We would like to know kung ilan po ang mga sabay-sabay na nanonood po sa ating webinar number 66 for today. And to put our discussion into context, TVUP has prepared a very short video to capture the pulse on the street po. TVUP?
Nakakaalam ko dito sa Lambda, maraming natatakot dito.
Unang na-identify sa Peru or sa South America.
Parang gina-deal na lang namin na the same lang siya sa Delta, pero mas worse pa yata ito.
Nandito siya like weeks ago.
Yung mga nabasa ko also about Lambda variant, categorized siya ng WHO as variant of interest. Nakakatakot po siyang marinig na meron na po tayo ngayon sa Pilipinas.
Sa bagay niyan, hindi pa naman ako nababakunaan. Pero kung liba bakunado ka na, mag-worry ka dito sa Lambda. Kasi ano siya sabi daw ito ay vaccine resistant.
Dito sa amin, to avoid at to maiwasan talaga namin ang sinusunod talaga namin yung mga protocols.
May halong takot pero may halo ding pag-asa because I think that big pharmaceutical companies would come up with an urgency na magkaroon ng supplementary na bakuna for the Lambda variant specifically.
Ayun, natatakot kasi hindi mo alam kung hanggang saan para maprotektahan ka ng vaccine to have a severe symptoms. kahit mayroon pang magsulputan na iba't ibang variants dyan, ang pinaka magagawa natin na proteksyon para sa atin at sa ating mga pamilya at mga kasama sa buhay is yung magpabakuna. Sana mas mapalawak yung vaccination ng government.
Dapat talaga dyan lockdown. Kaya ang kailangan dyan, ayuda ng gobyerno.
Kailangan lang talaga ng containment doon sa mga papasok na individuals from other countries.
Hindi man natin alam na may mga bagong variant na naman maglabasan, the same pa rin ang namin, precautions namin.
Hindi ako sigurado na magiging makakaraos tayo dito dahil nga doon sa mga nangyaring ganun. I might say na 50-50.
Tingin ko malalagpasan natin itong mga pinagdadaanan natin ngayon. Buong mundo ang nagtutulong-tulong dyan para malunasan yan.
Natin ma-end yung pandemic na to. Basta lahat tayo ginagawa natin yung part natin. Aside from following all these rules, dapat intindihin natin na may responsibilidad din tayo sa community natin, hindi lang yung pansarili at sa pamilya din po natin.
It's always good to start with our person on the street. And I think talaga Raymond, ang ating mga nasa audience, our frontliners are really very influential pagdating dun sa pagpapaliwanag ng ano ba yung totoo, ano ba yung hindi totoo. So napakahalaga na meron tayong usapang ganito. So Raymond, meron yata tayong Mentimeter. Yung ba yung announce ko? Okay.
Yeah, yes.
Yeah, let's put the Mentimeter code up, please, TVUP. All right, here we go. So, some of you really love the Mentimeter, yung mga nanonood na hindi po kayo sa Zoom, nasa Facebook kayo. So, you can already go to www.menti.com and the number is 11482304. So, for today, we have some fun questions that Raymond is going to field later. 11482304. Yung mga nanonood naman on Zoom, you can just participate on Zoom. That will come out for you. So, yeah, I know some of you are looking forward to that. Over to you, Raymond.
Thank you, Dr. Susie. It's been a few weeks since we had our Mentimeter poll po, no? And it's that as a regular thing. So, very, very happy. I'm sure there are lots of folks who are looking forward to participating sa ating Mentimeter. For those who are also joining us for the very first time, our structure is as follows. There will be essentially a roundtable discussion format to optimize the feedback and the insights that we will be getting from our panel of experts. We will have speakers who will be presenting, which includes also a few reactors, and then followed by a panel discussion with a Q&A session, and then we will be entertaining questions coming in from kahit po sa Zoom, sa Facebook, or sa YouTube po nito. You can also tag us sa ating Twitter account if you're able to ask any questions and you're really someone who's following us in the Twitter. For those who are asking also, we are continuing distributing the certificates of attendance for the previous webinars. It looks like meron po kaming maximum capacity that could be sent out for each day ng mga certificates. So that's something that we're trying to manage right now. But at least for the previous 64, 65 webinars, partially, we have already sent out the certificates of attendance. And only those who have attended at least 50% of the webinar duration will be eligible to receive a copy of their e-certificate. Okay, Dr. Susie.
Raymond, teka nga, ano ba? 66 na ba ito?
Yes, number 66. Malapit na tayong mag-70, Dr. Susie.
Been here for 66 Fridays and will always be here. And there are people behind the scenes who really make this happen. And that's my little segue to introduce our guest who will give us the opening remarks, who in fact is a moving spirit, one of the most important moving spirits behind Stop COVID Deaths. And we wouldn't have gotten to 66 without her, you've met her before, and she's a communications expert. She is the Vice President for Public Affairs of the University of the Philippines System and haligi ng Stop COVID Deaths. So let me welcome our beloved Professor Elena Pernia, or Nenny Pernia. Nenny, welcome to your webinar.
I thank you, Susie. I'm always here. And I'm glad naman that we are still here, 66 weeks and counting.
Oo, hindi nyo alam, yan si Vice President Nenny Pernia ay laging kasama yan. Kasama siya sa planning, kasama siya on the Fridays. And so it's just great to have this kind of support, Nenny. And I think on behalf of all of us, we just like to thank you for all the hard work you've been doing for Stop COVID Deaths. Sige na nga, emote ako eh. So
Kaya nga, emote masyado. Pero marami tayo dito na nagtutulong-tulong eh. So ako rin emote sa ating lahat na nandito sa Stop COVID Deaths. Pero game, okay na ako. Mag-opening na ako. Sige.
Game.
Okay. Every Friday for the past 65 weeks, many of us have been tuning in to Stop COVID Deaths webinar, our favorite noontime, credible online resource about COVID-19. Many of you who are here in this online community are in the medical professions, but there's a growing number of laypersons like me. Since the pandemic and the different levels of community quarantine that we have all lived under, there have been a lot of things that we, laypersons, have learned about COVID-19. I'd like to run by some of them, which I think are among the most important. So please, Doc Susie, Doc Raymond, tell me if these are correct. 1, everyone has to be vigilant. Wear a mask or double up. Wash your hands frequently, keep safe physical distancing, and importantly, demonstrate kindness to others. 2, the virus can be spread in airborne particles that linger in the air, which makes indoor and enclosed spaces riskier. So, physical distancing and masking needs to be coupled with good ventilation. 3, don't panic about getting COVID-19 from packages that are delivered through logistics companies, from the grocery and takeout food. But keep on washing your hands with soap and water or with alcohol. 4, young, healthy people, including children, are not invulnerable to COVID-19. 5, super spreaders are a major threat. 6, the spectrum of COVID-19 runs the range from asymptomatic, mild, moderate, severe, to critical. 7, there is such a thing as long COVID, and some can get infected more than once. 8, misinformation is dangerous. Don't participate in its spread. False information, often called fake news, that are shared on social media platforms undermine scientific advice and are inimical to public health campaigns that aim to reduce the spread of COVID-19 virus. 9, all viruses evolve over time. When a virus replicates, it could change a bit, and this is normal for a virus. These changes are called mutations or variants of the original virus. 10, there are VOIs and VOCs, variants of interest and variants of concern, which used to have alphanumeric names, B117, B1617, and then they were later identified by the places where the earliest documented samples were found, UK, South Africa, Brazil, India. But now, they are labeled following the Greek alphabet. Alpha, beta, gamma, and delta are variants of concern, while eta, iota, kappa, lambda are variants of interest. Mahaba pa ang Greek alphabet, baka dumami din ang variants. For the ordinary person who has been on some level of lockdown for a year and a half now, the questions in our minds include, will the pandemic ever end? What's the likelihood that the virus and its variants will disappear altogether? Or is the reality that there will be even more mutations? So we put our faith in modern technology and the rapid pace of COVID-19 vaccine development and administration to shorten the length of this pandemic. Isa pa, sabi nung aming COVID communication campaign, bakuna is love. Dahil mahal ko kayo, magpapabakuna ako. It looks like Pope Francis saw our campaign because he agrees. Sabi niya, being vaccinated is an act of love. Yun lang, Doc Susie and Doc Raymond. Isang magandang tanghali sa ating lahat. Sigurado ako na marami na naman tayong matututo ngayong hapon. Maraming salamat and over to you, our indefatigable Dr. Duo.
Bago yun.
Raymond, dapat to si VP Neni fini-field natin sa TV tsaka sa radyo
Yes.
Kasi it's not necessarily the medical expert who is needed right now. It's the communications expert. And she was so very, very clear. Neni, ano ba? Mag-guess ka na sa mga napakalinaw. I don't know, it's food for thought, right? Maybe what we need are communication experts really to talk, not the technical experts. So Neni, thank you so much.
Thank you.
Ang galing pati projection Okay, so Raymond, over to you na. Ano ba ito? Magme-mentimeter na tayo, no?
Yes, that's correct, Dr. Susie. Thank you again, Vice President Neni Pernia, for highlighting po the importance of disseminating the correct information. And I second the motion by Dr. Susie in terms of being able to tap our media partners po in doing this, no? Please join us po mamaya po in the Q&A session. And we really look forward to your insights also from the communications perspective, VP Neni. And then now, for our webinar, thank you so much, TVUP. These are the two questions that we have. You are seeing being flashed on the screen, and I'm seeing also a little over 370 individuals inputting their answers na po already in the opinion polls. We have two questions for this webinar, and we hope that those who are watching us outside of the Zoom will be able to join via the Mentimeter. So sa mga medyo po nahuli or nagtatanong, you go to menti.com and there's the code po sa ibabaw po ng screen na nakikita po ninyo. The very first question that we have, ang Lambda variant ay option 1, variant of interest, option 2, variant of concern, and option 3, variant of high consequence. We are now numbering 1,525 po, no? Dito po sa ating Zoom. We also believe that there's a whole lot more of you who are outside of the Zoom joining us. Please join us dito po sa ating menti.com na poll po. And then for our second question, okay, while we waiting for the second question po, no, I think we have 2,911 registrants for this webinar, Dr. Susie. So that's a little bit on the high side, at least for those who are registering for our webinar. We'd also like to greet those who are joining us from the Bayambang Rural Health Unit in Pangasinan, Ilocos Region, from Antipolo City in Calabarzon, from the University of Bohol in Tagbilaran, from Camiguin Medical Society, from Catarman, Camiguin, and also General Santos City LGU in Cotabato, Socsargen. Internationally, we have our National Center for Global Health and Medicine in Shinjuku City, Tokyo, Taipei, Taiwan, Ho Chi Minh, Vietnam, Bangkok, Thailand, Kupang, Indonesia, Dubai, UAE, Doha, Qatar, Riyadh, Saudi Arabia, University of Fiji in Lautoka, Lunichi Ali University of Blida 2, Algeria, and St. Catharines in Canada. For the second question, ang Lambda variant ay inaakalang nag-umpisa sa... So there are, ilan ba to? We have 5 countries here: China, Brazil, UK, South Africa, and Peru. So medyo meron na pong clue from our person on the street that was earlier shown in the early part of this webinar. We will leave our Zoom poll and Mentimeter na nakabukas lang po, no? We will try to wait for your inputs to this fun quiz. And as we try to move on to the webinar proper and to be introduced by Dr. Susie, our very first presenter.
Okay, thank you very much. Thank you very much, Raymond. I just picked up something on the chat, Raymond, that one of our viewers lost her baby. She was 5 months pregnant, had a miscarriage. She was tested positive for COVID and then lost her baby at 5 months. And I just want to sort of, parang nakikiramay ako. I just want to extend our sympathies. And just remember also that there are many of you who are exposed. I know of many people who have tested positive or have family members who have tested positive. It's really a difficult time, no? So we're just praying for everybody to be safe. And I think for our viewer who was asking the question whether her miscarriage had something to do with COVID, maybe, I don't know if any of our speakers lately will be able to address that, but it's very difficult to have a miscarriage, and our sympathies are with you, and our sympathies are with everyone in the audience who may have somebody who they lost during the pandemic. So just a sort of a little shift. I want to be sensitive to, what we are all going through, no? Napakahirap yan. But okay, on to our webinar. Okay, so we want to learn about the Lambda variant. And we have a very, very, what should I say, prominent expert who is going to talk to us about the Lambda variant. She is currently the director of the Philippine Genome Center, but she was previously director of the Institute for Molecular Biology and head of the sequencing facility at UP Diliman. So our guest today is Professor Cynthia Saloma, Director of the Philippine Genome Center. Professor Cynthia, welcome to the webinar.
Thank you so much for this opportunity, Susie and Raymond. And sa ating lahat na tagapakinig, magandang tanghali, maayong hapon, maayong panyaga sa inyong tanan.
Okay, so Bisaya pala si
Ilonggo.
Ilonggo, yeah. My mom's Ilonggo. Okay, but I can't speak it. I can understand it. Professor Cinch, I understand you trained in Japan. Am I correct?
Yes, Dr. Susie, I was there for 10 years as an undergraduate, MS student, as well as PhD student. So 10 years, 88 to 98.
Okay, so are you monitoring what's happening in Japan? Ano bang nangyayari doon nga?
Today I was really a little bit very, very concerned because all of a sudden from a case of 15,000, then they have 23,000 cases. And that is also, they're going to open the Paralympics in a very short while. Kaya it's a challenge really.
Deaths, marami ring namamatay, ganun ba?
Opo. They also have recorded some deaths, but not of course at the level of Indonesia that is recording 1,400 a day.
41,000 ang Indonesia per day. Okay, I mean...
ang deaths nila 1,400 every day.
Oh my goodness. Okay, so this is very important for us, no, for our frontliners, kasi sometimes it is natural for us to think about our situation and to feel very negative about what's happening. But I think it's a good reminder to hear about what's also happening in other places. So Japan, 23,000 a day, and Indonesia, 41,000 with more than 1,000 deaths a day. Hi, nako, teka. O sige, tapos may Lambda variant pa. Sige, Professor Cynthia, go ahead with your presentation so that we can be enlightened. And I think when we have information, we will not be afraid. We will fight. We will continue to, bring hope to our people through the information that we have. Go ahead, Professor Cynthia.
So I'll be sharing my screen now. So sa ating lahat ng tagapakinig, I'm going to share with you the latest that we know of about the Delta variant as well as the Lambda variant here in the Philippines. So if you look at this slide going from the data of GSAID, so GSAID stands for the Global initiative on the sharing of all influenza data. So this is really a public database where all of us who are doing whole genome sequencing of the SARS-CoV-2 virus share our information. And this has been an unprecedented level of sharing of the information we have from the different labs all over the world. So far now, mga 2.7 million have already shared their sequences. So if you look very closely at this graph here on the left, you will see that the Delta variant is rapidly overtaking the other variants of concern, particularly Alpha. If you look at the data in April, we will see that a lot of the submissions, or the majority of submissions to GSAID, were actually Alpha. But in a very, very short period of time, the Delta variant has already overtaken, with data suggesting that as much as 99% of current submissions are already of the Delta variant. If you look at the regional distribution of the Delta variant and the other variants of concern around the world, we will notice, for example, that in Africa, although the sequencing here is not as much as, for example, if you compare it to Europe, but still about 94% of the current sequence cases in Africa are of the Delta variant. And then, of course, in Asia, about 87%. In Europe, wow, 98% of the sequences shared, which is about 117,000, are classified as the Delta variant. Also the same for Australia, New Zealand, as well as in North America. But amazingly, in South America, it is still the Gamma variant that is predominating. Now, in the Philippines, we have already done sequencing for more than 11,000 cases, and this is our current data. As far as the Alpha variant is concerned, we have about 2,232 sequence cases, 2,483 for the Beta variant, and then a total of 807 Delta cases, with 2 Gamma and 347 P.3, or the VOI, which was referred to before as Theta. So if you look very closely in the Philippines also, this is really, really notable that in contrast to other countries, where a majority of the samples in the beginning were really Alpha variants, in the Philippines, we have more sequenced Beta variants than we have Alpha variants. And amazingly, lately, the Delta variant cases are really, really on the rise. I've not included here actually, but we have detected the first case of the Lambda variant, which I'm going to discuss with you today. So if you look at the number of sequences that have been done for the Delta variant has been detected in 115 countries. And the sequence count so far is about 248,123. The Delta variant was first detected in India on September 22, 2020, with the earliest sequence case. In our country, the earliest sequence case was swabbed on April 24, 2021. So here on the right are some of the defining mutations that you can see. So S would stand for the mutations in the spike region of the protein. And then you have also ORF3A, as well as in the other regions of the protein. So in our national data, for example, let's look at all the counts. So this is current as of August 14, which was the latest sequencing data we have shared to the Department of Health. So if you look very, very closely, this is on absolute number of cases. So I would like to, our absolute number of samples shared to us or sequenced by the Philippine Genome Center. So you can see, for example, that during the spike of cases in the National Capital Region, we will see that a lot of the samples were really coming from Beta as well as Alpha. But amazingly, between June and July, from a very small number of cases in the National Capital Region, nationally, we have now more Delta than either Beta or Alpha cases. In the National Capital Region, if you look very, very closely, you can see very well here that the Delta variant is actually the majority of all the sequence cases with swab samples coming in from June. And that has been a very, very fast rise in cases if you compare it with the data that we have from June to July. So July alone, we have about 68% of our sequence cases coming from the National Capital Region to be the Delta variant. So here is a histogram. You can see a very, very rapid rise in our sequence cases coming in from the different parts of the country, with 42% now for the July samples being represented by the Delta variant. We have to emphasize, of course, that these are based on the submitted samples to the Philippine Genome Center. So you have to anticipate there seems to be some biases in sampling, but at any rate, based on the data that we have on hand, we have 42% of sequence cases nationally being Delta. But in the national capital region, from 10.56% of cases sequenced in June, we now have about 68% represented by the Delta variant. So the Delta variant is not just B.1.61.2. This actually already includes some of the Delta-like or Delta plus cases. So with Delta, we have AY.1, 0.2, 0.3, and so on and so forth. I think there's already AY.12. So we all classify them as a Delta variant. Now, we have also noticed a noticeable a trend. We don't know whether this will continue, but we just would like this is very important that we share it to you. So of the 807 confirmed Delta cases we have that we have sequenced at the UP Philippine Genome Center, we also noticed that there has been a slight increase, or there's data that suggests that we have more cases of Delta in terms of percentage in the age group of below 17. So if you look very closely with the other cases, we notice that, of course, the absolute number is not very high yet, but we notice that this is a notable percentage in terms of Delta cases sequenced from samples coming from children below 17 and below. So if you have 13% of cases from the upper age group, but here we have in all the Delta and its sublineages to be slightly higher compared to the others. So these are some of the latest data we have in new information coming in about the Delta variant. It is associated with lower CT values in RT-PCR, and I think that reflects the very high viral load we observe. So at the moment we see CT values of 12, 14, 16, the possibility is really high that it could be the Delta variant. There are also information that came in where the viral shedding for the Delta seems to be lasting for 18 days compared to the other variants or the original strain where it was only for 13 days. So if this is borne out with more data, this has actually a lot of implications on our quarantine protocols. Number 3, the risk of reinfection in Delta may be higher compared to the Alpha variant, with reinfection higher when 6 months have elapsed. There seems to be more severe illness with Delta, but this needs further confirmation. So these are initial reports, but for the spread, where the Delta variant seems to have an R0 of 5 to 9, data suggests currently that it is as transmissible as the chicken pox, and Delta is more transmissible than either SARS, MERS, Ebola, common cold, and even smallpox. And that vaccinated people carry huge amounts of the virus. And this is really, really very important, that vaccinated people can be just as contagious as unvaccinated people. And number 7, well, as much as 75% of breakthrough cases with the Delta variant could happen, symptoms were generally milder, and that 99.5% of deaths occurred in the unvaccinated. And this is data coming from the United States. So now let's go to the Lambda variant, which is our main topic for today. So the Lambda variant was first detected in Peru. It has now spread to about 33 countries, probably 34 plus 1 in the Philippines. The sequence count so far is about 4,150 cases. And the earliest sample coming from Peru was collected on November 8, 2020. So if you look at here on the right side, these are some of the telltale or the SNPs, the hallmarks mutations of the Lambda variant. So you have mutations in air, in the spike region. This one, there's a 7 amino acid deletion from R246 to 252. And of course, I would like to emphasize that the Delta or the Lambda variants and all our variants of concern already contain the D614G mutation that was first spreading all over the world in June 2020. So these are some of the hallmark mutations in the Lambda variant. So rather, now let's go to the question, should we be afraid? Should we be concerned? So if you look at this graph from GSAID, look at this very closely, you will notice, for example, that the Lambda variant actually is not considered as a VOI by the US CDC. So the US CDC has its own list of VOCs and VOIs. The WHO considers the Lambda variant as a variant of interest, but the US CDC does not consider it as a variant of interest. If you look at the data based on submitted sequences, there's a marked decrease in the number of submitted sequences of the Lambda variant. And I think that was one of the reasons why the US CDC does not consider this a VOI, because it seems not to be spreading as compared to the Delta variant. So these are the new information coming in about the Lambda variant. In our country, we have only detected one out of more than 11,000 whole genome sequences we have analyzed at the UP PGC. The sample is from a 35-year-old female that was collected on July 22. This female is not a returning overseas Filipino worker. This was collected routinely in the community from a submission by one of our local laboratories. So in vitro data in Japan, so in Japan, the first case was on July 23, on the start of the Olympic Games. The mutations in the variant suggest that they have potential for immune evasion. So there's really a lot of information we do not know about the Lambda variant. But the concerning thing about the Lambda variant was because it was detected in Peru. And Peru is the #1 country out of the many other countries around the world. It has the highest per capita death rate in the world at about 5,900 cases per million population. So that's why people were concerned about the Lambda variant, where in the initial genome sequencing done by Peru, about 79% were Lambda variant in Peru, but their sequencing capability is really very small. So they are only sequencing less than 100 cases. So the one country with the most number of Lambda variants now deposited in GSAID is actually Chile. So though it has spread to more than 33 countries around the world, the Lambda variant is essentially moving around South America. So we need to have a lot more data as to the clinical and epidemiologic implications of this Lambda variant. But I would like to emphasize that vaccines work both for the Delta as well as the Lambda variant. They are very good at preventing severe cases as well as hospitalization. So I'm going to end here with my talk with the thanking all these young men and women at the UP Philippine Genome Center, as well as the funding support provided to us by the DOH, the DOST PCHRD, the CHED-PCARI, as well as the UP system. Thank you, po.
Thank you very much. That is Professor Cynthia Saloma of the Philippine Genome Center for an excellent, very clear presentation. And sabi nga natin dito sa webinar, gusto natin gamitin lahat ng talino ng ating bayan. And we're very proud, Professor Cynthia, of the work that you're doing, Philippine Genome Center is doing. And your fellow Ilongas and Ilonggos are also very proud of you. We can see it in the chat. Napakahusay daw. Mahusay po talaga. Mahusay po ang mga Pilipino, mahusay po ang ating mga dalubhasang ating po mga scientifico. So thank you so much. I think that for me, that made it really very clear where we are on the Lambda variant. And I'm going to turn over now to Raymond for our next speaker. Raymond.
Thank you, Dr. Saloma and Dr. Susie. Our next speaker po is someone who's not entirely new to us. He's a special advisor of the National Task Force Against COVID-19, also a faculty member at the UP College of Medicine, and has served as Undersecretary for the Department of Health You know him as one of the moving forces po for this Stop COVID Deaths webinar series. Please welcome back to the webinar, Dr. Ted Herbosa. Sir Ted?
Wala si Ted ah.
Ayun, okay.
No, I'm here. The host muted me. Okay, so thank you very much, Raymond, for that kind introduction. And of course, I'm very happy here and thank you for keeping this Stop COVID Deaths webinar alive. This was a crazy idea of that doctor there, Dr. Susie Pineda Mercado, who decided to use this. And we used the resources of National Telehealth and the Office of the Vice President for Public Affairs. And we've now produced 66 Fridays. That's amazing. So let me get straight.
People did
Yeah.
Ted. Kung hindi sa'yo, hindi ito natuloy, right? Okay, sorry, go ahead. Go ahead with your presentation.
No, but I'm very happy though of what you've done. So it's gotten a life of its own. So I would have wanted to talk about lambada, and Susie knows that I would rather talk about swing and salsa rather than talk about lambada. But they asked me to talk about the variants and the vaccines. The Philippines has been struggling, and there are so many what you call noises out there in terms of understanding the vaccines and the variants, and also COVID-19 and the response. And I'd like to talk about situation last night. We had a big meeting of the Asian Collaboration for Trauma, and I was talking about mass casualties. And one of the reactors said, the trauma surgeon should have been the one to have responded to this pandemic because of the way we think, the way the trauma surgeons think. With little information. We actually save your lives in trauma with little information. We don't wait for the information, we triage it. So that was a very interesting discussion, and I think the end point there was that everybody needs to actually contribute. We can see what has happened to this particular pandemic. And I cite this particular publication by Sirleaf and Punjabi on the last scary epidemic that happened in West Africa. This was the Ebola experience. And there were 5 lessons learned from that very scary experience. Remember, the mortality rate of Ebola is very high. So the first thing you do is slow down the virus. Ayan, lahat na yan ginawa natin. Ban public gatherings, close schools, ask your residents to stay home. Next, number 2, test, and test. Scale up testing. Medyo kulang pa tayo dito. We're matching about 40 to 50,000 tests a day. I think with the entry of the Lambda and the Delta, we should test more. About 120,000 tests a day is what we should be doing. Number 3, protect your healthcare workers. Remember, we saw these figures of people taking care of Ebola in full PPEs. And that's what we did. We bought lots of PPE. Ayun, nakuha na yung ating Secretary of Health for procuring all these PPEs. But it's important to protect the healthcare worker. And number 4 is repurpose arms of government, including the military. And this is where madaming nagsasalita sa social media who's never done an epidemic response anyway, or who's never done a disaster anyway. And they don't understand that the military, the uniformed services, have the manpower, have the logistics, have the experience to fight a situation like this, which is either a disaster or a pandemic. And that's what happened in West Africa. The 3 greatest armies actually went there to stop the Ebola from spreading all over the world. The UK, the US, and the French army all went to different countries and stopped Ebola. And number 5 is what the discussion is. And I think many people are claiming that the decision to do the MECQ this coming tomorrow is an economic decision and not a public health decision. I again disagree for people who say that, because health and economic should be taken together. You should listen to former Secretary Pernia on why the two should go hand in hand. Again, we understand this as a complex emergency where factors like political conflict, people saying bad things to each other online and even in hearings. And then there's continued conflict and violence by communist terrorist groups. And then there's poverty. People are pushed to poverty. And I really think this is as complex as an emergency you can think of. This was mentioned already by Susie. Communications is the number 1 thing they taught us when I was studying for crisis and emergency management in the University of Geneva. The CDC professor there from Atlanta, University of Atlanta, said, in epidemics, rumors spread faster than the virus. And that's exactly what happens here. That this is the reason why I think Stop COVID Death is successful. It has been a robust source of solid information from the experts in UP and thereabouts. So the variants came. The Genome Center is a very complex process, the genome sequencing. And we've identified the Delta, the lineage names are there in the alphanumeric names that was mentioned. And we were predominantly having the Alpha and the Beta, which is the UK and the South African. But very quickly, in a couple of months, Delta is catching up. So you can see it's about 807. I think this is the latest report of the samples that were fully sequenced. And that's very quick from the two leading causes, which is 2,000, and suddenly now you have almost 1,000. That's Delta. So that's driving your surge. The Lambda or the Lambada here is just 1%, just one case. So, it's still 0.01. So hindi pa natin pinapansin yan. And ang sabi nila, the expert said that when several variants of concern come in, there is the predominant one actually proliferates, and that's probably going to be Delta. This is another one. This is, I think, a study in communications. Kino-complain sa akin itong infographic ng DOH. Bakit daw ang liliit ng letters, ng number, pag dun sa bagong kaso, at mas malaki yung porsyento ng gumaling? So are they trying to brainwash? So even the way we communicate is very important, and I congratulate VP Neni for really stating all the things we need to do in very simple, plain language, and that's what's important at this time. So the Delta variant, how does it behave clinically now? From a public health perspective, we have 5 things that we know about the Delta variant. It's spreading rapidly around the world. It's 4 times more transmissible than the 2 previous predominant variants, Alpha and Beta. It is associated with different symptoms. They don't present the same way. And people will be more likely hospitalized, twice the probability of being hospitalized if you are infected with the Delta variant. And 1 dose of the vaccine is less effective, but 2 doses strongly protective. So what were the things that were studied about transmissibility? It's about the mutation. So that it has the stronger capacity to latch on the human cell, on the ACE receptor. So mas madikit siya, stickier. And because it can latch easily, it has another mutation that allows it to fuse and enter the cytoplasm and use the mitochondria to actually replicate much more, and then that cell dies, and suddenly you have a whole number of viruses in the body. The other thing they found out is that the symptoms, the number one, this is a study in the UK. I think this is in one of they used a technology wherein you will report similar to what we had yung speed, where you report your symptoms, and the top 10 symptoms were headache, sore throat, runny nose, and fever. Cough was rarer, and you don't see loss of smell in the top 10 symptoms anymore. And then what happens here is that the younger people who get the Delta infection are who are really the ones likely not to develop infection, mistake it for a bad cold or a bad sore throat or something. So this enhances the Delta spread. Unlike the other one, if you lose smell, takot ka na, alam mo nang ano na siya. The other things we found is that the hospitalization doubles. No, the higher chance of being hospitalized, especially if you have an underlying condition. So this is how our epidemic graphs have been looking. We've just had our peak last April, and the different lines here represent Visayas, Mindanao, NCR, NCR plus areas, and the rest of Luzon. What is interesting is that last year, when we had the July-August in 2020, we had sequential increases of cases. First, it was Cebu, then it was NCR, then it was 4A, then it was Region 3, Northern Luzon. So nag-sequence. Right now, it's all increasing at the same time. We have Cagayan de Oro in Mindanao, and Northern, you have the West Visayas also peaking. You have 4A and Region 3 also peaking. So it's all at the same time. So that's something. We're fighting fires all together at the same time. So let me go over to the vaccines. And the vaccines have been arriving at a pace. We already have almost 49 million doses of vaccines that have landed in the Philippines. And our goal really with the vaccination is to save more lives and recover the economy. and probably even integrate a vaccination plan for COVID in the future, even giving booster doses maybe as needed, depending on the evidence, and reducing our mortality and morbidity. But let me explain what a vaccination deployment program really is. People think it's just injecting a jab, and the way people post on social media is like it's a very simple thing to do. It's very complex. And I'm telling you, being part of the National Vaccine Operations Cluster, wherein Secretary Galvez asked me to help USEC Mirna, it's not easy, because from the source to try to procure it, to bring it and fly it to the country, eventually to store it in cold storage in national warehouses, and then divide them and then distribute them to regional warehouses, and the regional departments also distributing them in the correct numbers, in the correct brands to the different LGUs, and then eventually just landing in the right time at the right place in the vaccination sites for the right people, getting the first dose, the second dose, or the correct brand. So this makes it even, what makes this even more complex is we are doing this for 7 brands. When the Israelis came here, they only used Pfizer and a little AstraZeneca. But theirs was such a simple task, which is just deployment. Ours, we use 7 brands, and the 7 brands have different training programs, different storage, different packaging, different different everything, and they were amazed at how we were implementing it, and they were actually commending how the country was actually doing this. So we have several strategies on the vaccination deployment. 2021, this year, is really about containment and containing the disease by vaccinating 70 million, achieving what they now call population protection. So herd immunity is a dream, because you will always have mutations and variants, and I don't think herd immunity has been attained by any of the countries, even those that were ahead of us with the vaccination. And those countries that claimed herd immunity are now giving booster doses. So we do hope we get to protect people. So it's about containment, making sure there's less transmission. Next year, they budgeted 45 billion for probable booster doses. And let's wait for the evidence of these other countries that started giving booster. And then continue recovering the economy with more vaccinated Filipinos. And hopefully in 2023, we continue to have that virology institute and the Balik scientists and even our own vaccine production facilities. Now, the effort to improve vaccine rollout has started even last January, when we had a big logistics summit attended by all the experts of logistics and supply chain management from the different private companies. They have been giving their expertise since last year, actually, since even with the testing and the PPEs. But now they've gotten really to show us how they do it in Jollibee and McDonald's, to make sure that you get the brand of hamburger that you actually like at the store. So it's very similar, and their experts have been guiding our vaccine public health people in the overall distribution and containment. So the private sector has been very helpful in procurement with the tripartite agreement, in communications, as they're putting out their own money to advertise and encourage people to get vaccinated, in distribution and administration, the private hospitals and the malls, and even the what we call the big casinos, and then the data analytics as well. So globally, we actually know that the vaccine manufacturers had only been able to produce, will only be able to produce 5.8 billion for 5.8 billion. And it's a shortfall of about 2 billion for the total global population. And this is the current statistics. As of now, there are 22 EUAs, right? 21 EUAs. And the current rate at which the world is vaccinating is at 38.2 million. But you can see that's highest in countries like the US, Europe, and very light colors in Africa and the other countries. So the total vaccines delivered worldwide is 4.7. So the target is about 5.8 by the end of this year, which is what they can manufacture. And the rest of the deliveries will come next week. So we're vaccinating at 500,000 a day. So globally, we're doing 38 million a day. So we're contributing 500,000. And there was a time I thought we were going to reach 1 million a day, because we had a few days so that we were reaching 750 vaccinations per day. So this is the tripartite agreement. Not all the companies provide tripartite agreements. AstraZeneca agreed to that. Moderna agreed to that. I think Novavax also agreed to that. But Novavax is still going to be delivered in October. So this is where the private sector has been helpful. They help procure additional vaccines in terms of what we can give to the people through people's money or cost recovery. So it's not being sold, it's still being sold to the national government, but the national government allows this private sector to procure. For example, Mr. Razon actually procured 7 million doses of Moderna. The government procured 13. And together, that 20 million was a lower price than the actual rate if they just bought on their own. So it's actually helpful for each other. For the AstraZeneca, we have both the private sector and the LGUs with a total of about 19 million doses. And these are already arriving. Even the Moderna is already starting to arrive, but very, very small amounts. So this is our campaign. It's got a Gantt chart, and most of the vaccinations will actually happen this coming September, October, November. So the campaigns are very useful, and this is one campaign that I really like to mention all the time because it talks about how the celebrities are able to encourage people who are hesitant to get vaccinated. So we hear stories of fans of Marian that they will get vaccinated because she already got vaccinated. That's tremendous. And these actors and celebrities have been contributing for free. So hindi naman nagpapabayad yung mga yan. And they're posting their Instagram photos like yung iconic photo of Ding Dong and Marian na magkayakap with the V sign on their shoulder na kinopya ng lahat ng tao. Then instead of enforcement, we get enticements by giving discounts if you show your vaccine cards in over 190 establishments. And then there are very interesting approaches of the LGUs. You see, vaccine administration is the purview of the mayor. So from the regional office of the Department of Health, the vaccines go straight to mayors. And the mayors are the ones who plan the orderly and quick distribution and administration of the vaccines to the priority groups. So very important na mag-produce. Quezon City has the highest population. So if they don't do bakuna nights, we will never finish the population of Quezon City. And when they started it, gumaya si Taguig. Of course, Taguig has been very good as well doing bakuna nights. And yung bakuna nights, it feels like a fiesta. If you go to it, it's very interesting kasi may banda, may music. So it's like going to a fair. So it's like going to a fiesta, and the mood is different. So I think that encourages as well young people to get vaccinated, especially the people that are working in Bonifacio Global City. And then there's this mayor in Manila who started drive-through vaccination. Of course, he's also criticized for his no registration, can walk in, but his drive-through has been very effective in producing safe vaccination, especially for the senior citizens that you don't want to be in a vaccination area exposed to other people. And this is the big one, the very controversial one at Ngayong Pilipino. This is now functional in Paranaque, and it will also cater to 4A, to Cavite and Laguna, because its output is like, I think it can do 15,000 vaccinations per day. And it's a very efficient system. Of course, the hospitals are also given permits to actually vaccinate. So we're really ramping up vaccination. This is the mall. We're using the big mall. This is SM Ora in Taguig. And of course, the buses also, vaccination buses. So this is an old slide. The total, because there's been deliveries every week. And it's no longer 29. What has been delivered is 49 million since this slide had been made. And these are our priority groups. The two big circles are our most important priority groups. A1 is your healthcare workers. We're doing very well with that. Of the 1.6 million healthcare workers, we've given 1.539 doses. So that's a good accomplishment. So our health workers are protected. But our A2 needs more work. We're at 40%, 44%. In its level, and we want to reach at least 50% so that we can have them protected and not die. And this is the experience in Israel, even when they had Delta, because they're the country with the 90% vaccination rate, very little ICU admissions. I think we're already on 29, and we're about to reach 30 million doses administered. So we keep increasing this. That's the current rate we're doing, 500,000 vaccinations per day. And that's actually a good pace to reach the 70 million. And these are the areas with, of course, the highly urbanized cities are the ones that will get the vaccines first. And that's logical to reach the 70% of the population. Just to give you an idea of the different brands we're using. And this portfolio approach was suggested by the vaccine expert panel. And I would like to congratulate them for suggesting that, because we're one of 2 countries that use 7 brands. Most countries will use 1, 2, or 3 brands at the most. But there are 2 countries. I forgot the other country. I think it's a Latin American country that does also 7. And because of this, we always have supply. The problem really is about distribution and supply chain management. Now, do the vaccines work? Of course they've been working. Do the vaccines work in the against the variants? Of course they also work in the variants. And this is a viral post or meme infographic posted by the infectious disease section of the Philippine General Hospital, who by for your information has already converted to a full COVID hospital because of the surge. And they analyzed their cases of the 265 that were admitted on the day that this was put out on August 15. A majority of 187 were unvaccinated, 25 were partially vaccinated, and 53 were completely vaccinated. So in the ICU, so that means if you get vaccinated, you may still be hospitalized, but that doesn't mean you'll get into the ICU. But once you get into the ICU, look at the proportions. It's 9 unvaccinated, 2 partially vaccinated, 2 completely vaccinated. And it's the same for those that get ventilatory support or who are intubated. So it's proving to do its promise that if you are completely vaccinated, you can still get the infection, but you'll probably suffer a milder case of infection. I just shared this blog, this blog written by an expert, and rated some of the vaccines that are out there in the market based on efficacy and adverse events. So if you really look at it, the safest are the Coronavac, the Sinovac, Coronavac, and the Sinopharm. They're the safest, but they also have kind of a low efficacy. But as you go farther to the right of the graph, you will see the more modern Moderna and Pfizer, which will have more adverse events. And this is what we're seeing. J&J is somewhere in the middle. So this is just graphical, but it really doesn't matter if you don't have a side effect. So this is the population study. So let me clarify with that. So this is our target. We'll be able to get 50% of the population. We will stop this Delta surge somehow and not have as high as our neighboring countries. And if we reach 70, we will be able to really contain continued transmission and hopefully next year eliminate the disease. So mag-uumpisa na tayo sa B category. That means everybody else. The vaccines are arriving. I do hope everybody gets vaccinated when their time comes. Most recently, there were a lot of controversies that we need to talk about. The issue on vaccinating pregnant women. So the stand here is really on the latter trimesters. The interval of vaccination doses, they wanted to shorten it. The expert panel did not agree, and they continued 8 to 12 weeks for AstraZeneca. Provision of booster doses is not yet allowed. I say not yet because I think sometime we will be allowing it, but depends on who should get it and what should you get. Is it the same brand? Is it a different brand, etc.? Then the co-administration is also not allowed unless you have a severe reaction to the first dose that prevents you and increases your risk to death, and they'll probably give you a different dose. The single dose strategy, we also did not implement. Pediatric vaccination, we said we'll vaccinate first all the 18 years old and above. And when we complete that, let's decide if we will give the pediatric age group their vaccination. We also talked about the quarantine testing, which they reverted back from 7 days to 10 plus 4 or 14 days. And now there's a strategy to get senior citizens, whoever is bringing them to the Bakuna Center, will also be given a vaccination, even if they belong to the B category. So parang 1+1. So parang freebie yun for bringing a senior citizen to the vaccination center. So the ideas of what to improve. And this was mentioned to us by VP Neni. Let's say hi to each other and hello, kamusta, and everything else. So this was the picture of the COVAX delivery of AstraZeneca, the Sputnik delivery, and this was yesterday. 3 million doses of Sinovac, the largest delivery of Sinovac in a single shipment via a Boeing 77. And with this slide is really all about looking at the whole picture from a big picture look. So let's look at the economics. Let's look at our neighborhood. Let's look at education. Let's look at food for the poor. Let's look at the social context and also improve our health system. So with that, I'd like to summarize that we've talked about the global situation of the COVID-19, both globally and nationally. Talked about the Delta variant and its clinical features, our vaccine deployment program as it's happening, and very important that let's look at this from really a big picture look, which is looking at the social determinants. Maraming salamat, Susie and Raymond, and back to you guys.
Thank you so much for that quick update, Dr. Herbosa. Very, very important to note, no? As I've been reading the comments on the chat with regards to the booster. We have already had public responses from our government officials that boosters will initially be started po for the front carriers as well as yung mga immunocompromised. So very, very similar to how it's being done in Israel and the United States when they will be starting the booster program next month. Okay, over to you, Dr. Susie, for the introduction of our reactors.
Yeah, okay. Thank you very much, Ted. Always a pleasure to listen to Dr. Ted Herbosa because he gives us that insight. You know, Raymond, sometimes in media, you know, what can you say in 5 minutes, right? That helps reassure people. It's very difficult. So I think it's really great to have Ted on the webinar occasionally just to give us the lowdown on what's really happening because it's very easy to sow fear. O yung parang magkalat ng duda, magkalat ng nega na mga sinasabi. Pero ito nakikita po natin na meron talagang mga pagbabago. No? Naalala ko, Raymond, when we started, I can't remember who it was who said that we would only be able to get 10 million vaccines this year. And you can see now that we have more vaccines, more vaccination will be done. And seeing the spread from Ted, no, the plan and how things are moving, I think we are going in the right direction. We just need to hang in there. Mahirap po talaga. Mahirap po talaga. It's really difficult everywhere, but the government is moving. And thank you, Ted, for that excellent presentation because again, it became very clear to people na ito yung nangyayari. All right? Merong nangyayari at malaki yung nangyayari dun sa pagbabakuna. All right. We're going to our next speaker who is actually from the private sector, Raymond. And we thought we would invite somebody who could talk about how the private sector is helping. Because, for example, in the transport of vaccines, right? The airlines are bringing the vaccines. Ted showed us that diagram where you have to bring the vaccines to all the different parts of the country, no? And in a situation where business is low and you know, people are afraid to work, our private sector has stepped up. So it's my pleasure to introduce to you the Vice President for Human Resources. Again, lahat ng talino kailangan gamitin natin dito sa pandemya. Siya po ay dalubhasa sa human resources, has been working in the corporate sector for some time. Very young but very energetic, and I would say someone we want to be proud of also. Human resources for Cebu Pacific Air. I'd like to welcome Felix Dan Lopez. Felix, welcome to the webinar.
Thank you for the kind introduction, Dr. Susie. Not really very young, but thank you for that.
Okay, Felix, that's what Cebu Pacific is doing.
Okay, let me share my deck. Give me a sec.
There we go.
Okay, I hope I'm coming in clear.
Yes.
Yes, you are.
Go ahead.
Great. Okay, it's really my privilege to be sharing the Cebu Pacific story with you this afternoon. Really humbled to be sharing the same panel with Dr. Ted and Prof. Cynthia, and later on also with Dr. Raymond. Let me start with this slide. I think it is apparent that this pandemic is really the strongest headwind Cebu Pacific or any other airline for that matter has encountered. For the next few minutes, let me share with you our journey and how we remain cautiously headstrong as we continue with our flight to recovery. Like what Doctor said earlier, and what also Dr. Susie mentioned, I am wearing my private sector hat, sharing the same objective as that of my esteemed co-panelists of achieving an all of society, all of nation approach in fighting COVID-19. The pandemic had an immediate and negative impact on the private sector for sure. And that challenged us to be agile, to be more relevant, and contribute to help drive the recovery process forward. We are 2,558 employees strong who continue to serve as our customers, both cargo and passengers, amidst the tough conditions. But what the pandemic taught us is that the company's circle of concern cannot just be ring fenced with merely the employees and our customers' welfare. The circle has really widened to include employees' families, the communities where they belong, and the society in general. Indeed, the pandemic is an inflection point, and it depends on all of us how we will adopt and respond to it. To date, 91% of SEB's total workforce have been inoculated, while 93% of our pilots and cabin crew have received their vaccine doses. Even before the pandemic, the safety of our flights has been a topmost priority. With this crisis, now more than ever, health is a primordial concern. Rightfully so, we continue to ensure everyone will feel confident to fly with Cebu Pacific, thus are championing vaccination efforts. We have secured enough vaccines for our employees and their dependents, and for our third-party workers, not only in Cebu Pacific, but for the whole conglomerate JG Summit Holdings, Inc. We are also very thankful, given the partnership with several local government units, such as Pasay and Cebu, to have a quicker uptake. This whole initiative is also in line with our shared vision with Ingat Angat, a private sector-led campaign that promotes safety measures and vaccination to help foster a nationwide economic recovery. We've heard Professor Cynthia earlier and Dr. Ted explaining about the Delta and the Lambda virus, especially now that the virus is really evolving with variants of concern and variants of interest. We continue with education and information dissemination. Top of the list of topics would be the importance of vaccination, communicating principles such as the earliest vaccine in your arm is the best vaccine, and something very specific for Cebu Pacific, that domestic travel will rebound earlier than anticipated if we reach higher vaccination levels the soonest. Proud to note that compared to April 2021 survey results of Cebu Pacific population's willingness to be vaccinated at 94%, we are now at 99.4% and are still painstakingly convincing, educating the remaining 15 people of 2,558 who are still unwilling to be vaccinated. Despite high vaccination levels, we cannot be complacent. We continue with surveillance using our Test Before Duty initiative. We require all frontline employees, pilots, cabin crew, airport staff to undergo testing prior reporting for work or flight. We started with antibody testing from May 2020 to October 2020, then shifted to antigen from November 2020 up until now. Surveillance is beneficial for both our frontline employees and our flying public, since we only release those people who tested antigen negative for duty. With Test Before Duty, we are able to also do robust data gathering and reporting, especially now on breakthrough infection cases. We needed to recalibrate our employee priorities. With the pandemic, health and safety of our employees, their families, and the communities they operate in became top of our agenda. We were quick on our feet and mobilized programs, some of which you can see on this slide. Free medical, teleconsultation, telemedicine for our employees and their dependents. And by dependents, we accommodated people within their network, such as house help, drivers, extended relatives or non-relatives living with them, among others. Leveraging on our conglomerate size and shape for assistance in hospital access when needed. Free testing or supported by their HMO coverages. We even converted an area to be an isolation facility for people with known exposures and waiting for their test results. And mental health support, which is a critical area of concern, especially now. We had to continuously build and develop employee trust in the organization with various communication initiatives, such as 12 leadership and 5 organization-wide virtual town halls and 5 virtual kapihans, coupled with targeted internal comms. We encouraged and facilitated collaboration in a hybrid, flexible work environment. Employees can work on-site, they can work remotely, or a combination of remote and on-site. We started this in 2020 and we communicated to the organization that the setup will be followed up until the end of the year. We are also now in discussion to apply hybrid work arrangement with some guardrails in 2022 and beyond. We maintained employee productivity and engagement through disruption and uncertainty via learning programs such as SEB University on the Go. From synchronous classroom programs pre-pandemic, we had to quickly pivot to a synchronous bite-sized virtual weekly learning, and in 2021, gradually reopened synchronous classes, albeit virtually. And engagement initiatives such as one online community channels, as you can see on the right of this slide. We optimized our virtual platform to host non-work related employee interests, such as arts and crafts, recipes for those who love cooking, parenthood, spiritual, physical health and wellness, among others. 2020 was Cebu Pacific's toughest year, with headwinds so turbulent, but we were able to withstand the odds and yielded high engagement score and high net promoter score from employees, given the initiatives laid out earlier, which focused on employees, their families, and the circles they operate in. On top of our high-level vaccination rates among our staff and the test before duty surveillance, we have adopted a layered approach to biosafety measures to help curb the spread of the virus on board. Masks and shields are still required. Extensive disinfection are performed by personnel certified by the BOQ. And our aircraft are equipped with hospital-grade, high-efficiency particulate air or HEPA filters, which effectively circulate clean air every 3 minutes and eliminate microscopic particles with 99.99% efficiency. International Air Transport Association, or IATA, shows that the condition in the air cabin makes transmission of virus difficult, as airflow exchange rates and directions are less conducive to droplet spread. Besides implementing stringent health protocols through our multi-layered approach and advocating vaccination and safe practices, and I think this was mentioned earlier, we have also transported millions of vaccine doses for the Filipino people. SEB has carried over 16 million COVID-19 vaccine doses from China to Manila and over 5 million doses to 20 provinces nationwide to date. We have also flown special commercial and bayanihan flights bringing home Filipinos from the Middle East. We were able to also fly home more than 1,000 Filipinos via repatriation flights. And this is our commitment. As part of the private sector, we will continue to do what we can to contribute to whatever will speed up the process of recovery in our country. Because by doing such, we will also be able to paint the skies yellow again. With that, thank you so much, everyone, for listening.
Okay, thank you very much. That was Felix Dan Lopez. I don't know if I'm the only one who's having another moment here, but I just want to thank you, Felix, for sharing that with us. Really, the private sector plays a huge role, and I could see through all of the things that you're doing to protect your workers, to make sure that passengers are safe, and to actually transport vaccines and transport our OFWs is really such a heroic effort for you. So I just like to thank you on behalf of all of us who are listening to you. And it makes us all very proud to be Filipinos and to be supporting each other in this way. Raymond, nag-emote na.
Really, yeah, thank you, Dr. Susie. Really,
Good.
all hands on deck if we really want to make sure that we recover fast in this crisis. Thank you so much.
Thank you, Felix. Oo. Raymond, nandun ka pa? O, sige.
Yes, Dr. Susie. We're really just very grateful to the private sector. Also, the Cebu Pacific figures prominently po, no? But there are also other private companies who are also contributing. As mentioned by Sir Felix, talagang all hands on deck, and hindi po matatawaran ang inyong contribution sa ating response and as part of our getting out of this pandemic po. Okay. For our final speaker for this webinar, and he will also be reacting, hindi po kaila sa atin that the Philippine Red Cross has been truly instrumental as part of our work in the COVID-19 response, and one of the, shall we say, one of the most hardworking mga busy bees po talaga, kumbaga, sa Philippine Red Cross. Ang kanilang clinical services aspect, and the clinical services coordinator for the Philippine Red Cross today will be giving his reaction as part of his talk for today's webinar. None other than Dr. Noel Bernardo. Dr. Bernardo?
Gandang hapon po sa inyong lahat. So, I will also share my slides po.
Yeah, Dr. Noel, welcome. And Raymond, I wanted to say something before Noel speaks.
Go ahead po.
I've had the chance to work very closely with the Philippine Red Cross in the past, as you all know. And Chairman Richard Gordon really is a force of nature. I don't know if you recall, Raymond, in the early days when it was only our ITM doing the testing. And remember, in the first few days of the pandemic, we had to send our samples to Japan and Australia. And Chairman Richard Gordon immediately saw that the Philippine Red Cross could play a big role in testing. Kasi kung wala nga naman tayong testing, how do we know who's going to be isolated? And it was really a very difficult position to be in. But Senator Gordon actually made it possible for the doors to be opened for more testing. Not only that, the Red Cross has been at the forefront of providing support to the hospitals. Yung mga tents, nakikita nyo. I'm sure Noel's going to talk about this. Food, the saliva tests that are now available that make it really faster, no? And of course, just helping our patients through ambulance care and so on. So I just wanted to say that, the other days we've had Secretary Pao Obial, but it's really an honor to have Noel Bernardo, who, I don't know, Raymond, it's in the notes kasi, no? Doctor to the barrio ito dati, no? So one of our young doctors who is really committed to just service, and he's in the best place by being in the Philippine Red Cross, which is really, truly committed to humanitarian service. So Noel, go ahead with your presentation.
So maraming salamat po, Doc Susie. Tapos magandang hapon po sa inyong lahat. Again, I am Dr. Bernardo po from the Philippine Red Cross. I'm a humanitarian physician and also the Clinical Services Coordinator. At masaya po akong ikukwento sa inyong lahat ngayong hapon yung mga ginagawa po ng Philippine Red Cross to contribute in our nation's pandemic response. So siguro po to start, gusto ko po sanang ipakita sa inyo ano ba yung paniniwala ng Philippine Red Cross. We believe that if we have compassionate volunteers, we have strong logistical support and efficient and relevant information systems, we will always have our Philippine Red Cross, which is always first, always ready, and always there. 6 na buwan pa lang po ako sa Philippine Red Cross kumbaga bagong-bago pa, fresh na fresh pa. So ginawa ko po, for this afternoon, ni-research ko kailan ba nagsimula yung paghahanda ng Philippine Red Cross for this pandemic, no? Nakita ko po to noong 2017, no? Nung kasama po sa Philippine Red Cross si Doc Susie, they were actually starting to do consultative meetings for a proposed Red Cross Institute for public health emergencies. Ang goal po, makapag-ready tayo sa panahon na meron tayong pandemic, plagues, or any other public health emergency needing response from the humanitarian sector. And since then, the PRC has been preparing for pandemics and any other disasters, no? Actually, noong January 2019, 1 year before we had COVID po, PRC already conducted chemical, biological, radiologic, nuclear disasters, and plagues training po. Tapos po, tinaas po natin yung ating surveillance systems to make sure na pag dumating po yung mga pandemic, katulad ng what we're experiencing right now, handa na po tayo. Laging, kung titignan niyo yung picture na to, di ba may hawak si Chairman Gordon na The Great Influenza Book. Laging pinapresent niya yan since dating-dati pa na dadating daw ang panahon na magkakaroon tayo ng pandemic. At totoo nga, no? Nagkaroon tayo ng Great Influenza. This influenza happened, yung nasa libro po, happened 100 years ago, no? At doon po nakita natin how people started to take care of each other, na pagtulong-tulong, sama-sama, kinaya po nila yung pandemya. And Red Cross is trying to be in that to be the platform, no? We want to become the catalyst for that social initiative na dapat po lahat ng sektor nagtutulong-tulong, public, private, humanitarian organizations, lahat ng pwedeng tumulong, mag-ambag po tayo for us to survive this great pandemic. Okay? And that is why if you look at the response platform of the Philippine Red Cross, ang gusto ni Chairman Gordon sa amin, lahat tatamaan po namin. This is the all levels po ng response natin ngayon sa Philippine Red Cross. We want to make sure that we're doing something to test individuals, to fight this invisible war. We want to make sure na pag na-test natin sila, ma-isolate natin sila safely sa mga isolation units para ma-prevent yung community transmission. Yung mga na-test natin na nag-positive, that we want to give immediate medical response, kailangan nagagamot natin sila kaagad para mabawasan yung pagkamatay ng mga tao. And for those who are safe, those who are not infected yet, we want to protect them. We want to make sure that they're safe, that they're healthy, and they're doing something through their own efforts. No? Pag yung pagpapabakuna nila, it is a contribution for the resilience of their communities. Kaya po, lahat ng programa ng Philippine Red Cross, gusto natin tumatama tayo sa apat na yan. We have established the molecular laboratories. We have isolation units, community-based isolation units to isolate infected individuals. We have been supporting a lot of hospitals, 28 hospitals deploying 96 medical tents nationwide to serve as field hospitals po, no, para maging surge capacity po ng mga health facilities natin. And right now, we are ramping up our efforts in making sure that everyone gets vaccinated as soon as possible. Okay? For the molecular laboratories po, I want to show you the story of our testing. No? Right now, the Philippine Red Cross is testing 1 for every 4 Filipinos. No? So isa sa kada 4 na Pilipinong nagpapatest, malamang sa Philippine Red Cross po yan ginawa. At sa NCR po sa Metro Manila, mas mataas pa yung data natin. No? Isa sa kada 3 test sa Metro Manila, sa Philippine Red Cross po yan. No? And I think this is one of the greatest contribution of the Philippine Red Cross to our response right now. Dahil kung nakita-test natin yung mga tao, alam natin kung sinong infected, napipigilan po natin yung pagkalat ng COVID. No? Kaya naman po, doble talaga yung efforts namin para lang ma-make sure na lahat tayo natetest. Hindi po naging madali para sa Philippine Red Cross yung pagtatayo po ng molecular lab. At nakwento nga po ni Doc Susie, isa kasi kami sa pinakauna, no? April 14 pa lang po, nagtetest na kami. That's just 1 month after we declared the first community quarantine here in Luzon. Medyo masalimuot po yung pagsisimula namin kasi hindi naman lahat alam kung ano yung testing, no? At konti talaga sa industries natin yung gusto pumasok dyan. At sa panahon po na lahat takot, lahat gusto magstay at home, ang hirap po talagang kumuha ng mga volunteers and passionate health workers to help us in our testing efforts, no? Pero po sa tulong po ng mga initiatives from our leaders like Chairman Gordon, the governors of the Philippine Red Cross, and different chapters po, community-based engagement po ang ginawa natin. We were able to establish and empower our communities to parang promote testing, hindi lang po dito sa mga centers natin, sa mga metro areas, kundi pati sa mga probinsya. Over the past few months, grabe po yung expansion ng Philippine Red Cross. We have established different mega swabbing facilities in partner with different local government units. So yung mga government units, LGUs, na meron pong mega swabbing centers, malamang sa Philippine Red Cross pa rin nila pinapadala yung mga samples po nila. Yung mga LGUs na walang kakayanan magtayo ng sariling molecular lab, we have been supporting them, no? Giving them parang partnership na na-charge nila sa either sa funds nila or sa PhilHealth para hindi po gumagastos, tinatanggal natin yung burden ng paggastos sa testing from our patients para hindi sila natatakot magpa-test. We have been placing our molecular laboratories in strategic locations nationwide, and we have been embracing technology, no? Gusto natin high throughput testing. Ayaw natin ng pakonti-konti. Gusto natin efficient para marami po tayong natetest ng sabay-sabay in different areas. The strength of our testing lies on our capacity to provide fast and accurate results para po magkaroon tayo ng timely intervention. Kaya po yan, lagi kami pinupukpok yan dito sa Philippine Red Cross. Lagi sabi ni Chairman, dapat mag-test tayo na mag-test. Taasan mag-test. Mag-test tayo sa kung saan-saang lugar. Ganyan po talaga yung mindset natin dito. Kasi dapat nalalaman natin kung nasaan po yung kalaban. At dapat kapag na-test natin sila, nag-positive sila, alam din nila kung saan sila pupunta. Right now, we have 14 molecular laboratories strategically located nationwide. Kaya kahit saan ka pumunta sa Pilipinas ngayon, may makikita kang Philippine Red Cross ready to test your samples, ready to parang give you advice if ever positive ka. And tumutulong po tayo sa mga local government units for their own community quarantine protocols and testing efforts po. Our capacity right now is at 48,000. Kaya nakakalungkot na medyo mababa pa rin talaga yung testing natin dito sa Pilipinas. Underutilized po kami sa totoo lang. Pero kahit na gano'n, we're still developing new technologies and we will continue to expand in the months to come. Okay? I would just like to share this kasi gusto ko makita din nyo kung paano yung istorya ng response ng Red Cross sa COVID response is closely associated sa story din ng UP. Maraming UP graduates yung tumutulong sa amin. This is Dr. Diana Ranoa, a graduate of MBB. So, parehas kaming galing MBB. Teacher namin dati si Dr. Saloma, no? And isa po siya sa mga naging consultant namin to introduce a game changer po in testing, no? So, we introduced the saliva testing this year po. So, we believe that through the saliva testing, we could parang give quick and safe testing protocol po, the non-invasive, very accurate, and as accurate po as our swab. Maganda po kasi sa saliva testing, madali siyang gawin. Nagkokolekta lang tayo ng laway. At bilang isang dati pong doctors to the barrios, sobrang na-appreciate ko yung initiatives na to ni Chairman Gordon at ni Dr. Ranoa. Kasi ngayon po, nakapag-test na kami kahit yung mga nasa bundok, kahit yung mga nasa isla, because of the stability of our sample, kinakaya po natin silang itest. So, nationwide na po ang hagip, no, ang sakop ng ating mga testing efforts. Wala na pong napag-iiwanan. Kung gusto mag-test anywhere in the Philippines, basta kaya nating ma-instructan on how to properly collect the saliva, how to properly transport the saliva, kaya nating ibangka, aeroplano yan, di ba? Nagagawa na po natin. And I think this has been the game changer, no? Kasi kahit saan pwede tayo mag-saliva testing. We have established collection sites all over Metro Manila in strategic locations there, no? Yung mga high traffic areas, mga malls, mga simbahan, di ba? Mga parking lot na malalaki para safely makapunta yung mga tao at makapag-test po sila. Nilalapit na po natin yung testing sa mga tao para po sila po mismo magkaroon ng initiative and good behavior, no? Parang positive behavior towards testing. And kahit po na malaki na po yung naaambag ng Philippine Red Cross sa testing, we will continue to expand our efforts. Right now, we are planning to open 5 more molecular laboratories nationwide. Gusto namin talaga lahat ng isla ng Pilipinas may Philippine Red Cross Molecular Testing Center. And we have been in close partnership with the national government in different research institutions, even with the Philippine Genome Center, in helping po na makabigay ng sample para continuously makatulong po sa surveillance efforts ng Philippines sa mga bagong variants natin ng COVID-19. So yan po. So yan po yung naging efforts namin sa testing. Next po tayo sa isolation. So for isolation, as a community doctor before po na doctors to the barrios, naniniwala po ako na yung communities dapat yan po yung pinaka magpapagaling sa isang pasyente, no? Pag hindi mo sila in-uproot, mas naaalagaan sila ng mga kapamilya nila, kasama nila sa community, no? At mas mabilis po yung paggaling nila. Kaya po yung Philippine Red Cross, parang umiwas kami sa pagtatayo ng mega isolation facilities and establish multiple community isolation units in partnership with our communities, barangays, and also the private sector. Ito na po yung bagong Big Four para sa akin, no? Dahil nung nagtawag po kami ng partners, ito po yung apat na kaagad lumapit po sa amin to partner with the Philippine Red Cross to establish parang isolation units for positive patients na mild and asymptomatic po, na stable po yung status nila. So kailangan lang talaga ihiwalay sila. So Lasal po, no, with Benil, UP, Ateneo, and Adamson. So nandyan po yung mga unang apat na aming isolation unit. We want to make sure that we are giving the highest quality of care to our patients, and we make sure that they're comfortable. No? Gusto namin, pag pumunta sila sa isolation unit, masaya sila, may dignity, at para ma-encourage na yung ibang tao na walang nakakatakot magpa-isolate, no? Dahil inaalagaan ka. Kumpleto po sila sa pagkain, naka-aircon, may HEPA filters, at binabantayan po ng ating mga doctors at nurses. Ito po yung mga contribution natin in partnership with the different sectors, no? At hindi po yan ginagawa mag-isa ng Philippine Red Cross. So, kumpleto po yan with emergency systems also. May mga ambulance po tayo na naka-standby, may mga nurses at doctor, at meron po tayong mga emergency medications for immediate interventions in case mag-toxic po yung mga pasyente natin. We also want to preserve dignity, no? So gusto natin, kumpleto tayo sa wash facilities, no? Naalala ko dati pinapagalitan kami ni chairman kasi ayaw niya na nakatabo yung pasyente. Gusto niya naka-shower, gusto niya naka-bidet. Kasi ayaw nilang nafe-feel na parang kawawa sila. Gusto nila parang naka-hotel. Gusto nila parang glamping, no? Ganon yung level ng alaga na binibigay natin sa ating mga isolation unit. Na-replicate po natin to when UP called us. Sabi lang, gusto din namin magtayo ng isolation unit, agad-agad po pumunta po yung aming mga volunteers. We have volunteer doctors from UP. This is Dr. Michael T. and Dr. Pauline Ubial, graduates also of UP. No? So, nagtayo po kami ng isolation unit sa ating dormitory po sa UP Diliman. Okay? Lasal also converted some of its classrooms and one whole building po for our isolation. So, to cater to the city of Manila. And Adamson also, so dito po natin nilalagay yung mga frontliners, health workers. Marami po kasi tayo pang health worker yung walang mapuntahan after getting COVID, no? Sila pa yung walang matakbuhan, walang ma-isolatan, no? Kaya po nagbigay po kami ng dedicated facility for them para makapag-house ng mga volunteers natin, mga health workers and other frontliners po. And recently po, we opened facilities po in science high schools, no? So ito po sa Makati Science High School. Ngayon po nagde-develop kami dito sa Mandaluyong and even other LGUs. So basta po may mga public spaces at mataas po yung number of infected patients po sa isang area, nagtatayo po kami ng isolation unit to help in their community's response. Alagang-alaga po natin yung mga nagkaka-COVID, no? Meron silang quarantine care package. So para silang may gift pack, no? Pag nakapasok po sa ating isolation unit. At lahat po yan binibigay natin. They have their own monitoring equipment and also food. And also psychosocial support. So nagpapamask kami, nagpapabingo kami. Tomorrow may pageant sa isang isolation unit namin para lang hindi sila mainip. Sa dami nila doon, nagtatayo na po kami ng other activities to make sure that they're safe, they're healthy, and they're happy while being quarantined po sa ating mga isolation unit. Okay? So next po, we want to treat patients with COVID. So I will share this video po for which will feature our emergency field hospital.
Noel, there's no sound. Noel?
Yes po. Sige po, hindi ba narinig po?
Oh, we can't
Sige
hear.
po.
Do
Sige
you
po.
have headphones on?
I'll narrate na lang po siguro. So this is our emergency field hospital po, established in the Lung Center of the Philippines. So partnership po yan. And we were able to establish an 18-tent complex po, no, to cater to mild, moderate, and severe patients requiring low O2 flow. So pag po kasi mga toxic patients like mga may comorbids, mga senior citizens, hindi na po sila pwedeng pumasok sa isolation unit. So what we did is we established parang extension hospitals po, no? And this one is the biggest in the Lung Center. 18 tents po yan with 64 to 100 bed capacity, complete with nurses, doctors, emergency oxygen systems, no? And ang maganda po dito, partner to with the hospital. So pag kailangan po ng emergency care, kailangan biglang mailagay sa ICU, we can immediately refer them. Right now po, we have 96 medical tents deployed nationwide, supporting 28 hospitals And right now po, kahapon lang, nagbubukas kami sa Cebu, which is one of the hotspots right now, no? In the next 2 weeks po, we are establishing 50-bed capacity hospital naman po sa Bataan, which is another hotspot of COVID. At today po, kahapon lang, kanina po, natapos na po yung aming emergency field hospital extension po sa Subic. So patuloy po ang Philippine Red Cross sa pag-provide po ng mga medical na tents na to. Huwag po kayong matakot na sabi, komportable kaya dyan? Okay kaya dyan sa mga medical tent? Komportable po dyan dahil naka-aircon yan, naka-filter. Tapos katawag namin dyan glamping no? Kasi nagtatanim pa kami ng halaman sa paligid to parang complete psychosocial, biopsychosocial treatment for our patients. And the response has been very positive kasi ang ayaw na ayaw po talaga namin at lagi kaming sinasabi ni Chairman Gordon, ang ayaw natin yung nakahandusa yung mga pasyente sa labas ng emergency room. Yung ayaw natin yung nawawalan sila ng pag-asa. So gusto po natin through our emergency field hospital and medical tent initiative, may laban po yung bawat Pilipino. Yung mga kailangan magamot, magagamot kaagad. Yung mga kailangan makapasok sa ospital na ipapasok po natin kaagad. So continuous lang po yung deployment natin dito and we will continue to support different hospitals. Right now, we are acquiring 100 more units of this medical field hospitals to support other hospitals na magre-request pa po sa atin. We could also convert these tents po into isolation units, into vaccination centers, and other COVID-19 health response projects po. Okay? So last po is the vaccination efforts of the Philippine Red Cross. Okay? So we are now establishing the PRC Bakuna Centers. Trivia po muna bago ko mag-proceed. No? So in 1939 po, the Philippine Red Cross, the Philippines donated vaccines po para mag-address ng isang parang epidemic din po sa Republic of China through the Philippine Red Cross, and the vaccines were produced by the University of the Philippines. No? So Philippine Red Cross yung nagpadala, UP ang gumawa, at gobyerno po ng Pilipinas yung nagpamigay nun. So ganun po, kadikit yung Red Cross sa UP at sa national government response. At sana po, ganun pa rin po ngayon habang we're fighting this COVID-19 pandemic. So the three main approaches right now of the Philippine Red Cross is to establish bakuna centers, to deploy vaccination teams to different LGUs, no? Supportan natin sila, and to deploy mobile vaccination clinics. For the PRC Bakuna Centers po, ito na po yung mga natayo natin. So madami na po, all over NCR, Luzon, Cebu, Visayas, and Mindanao po. So sa NCR, meron na po tayong 10. Sa Luzon po, may 5 na. May isa na po sa Visayas at may 2 po sa Mindanao. And right now po, nadagdagan pa po yan ngayon. Sorry, hindi po updated. Meron na po tayong bagong 4 sa Cebu alone, Cebu Province alone, at saka 3 pang bago sa Mindanao. Okay, so ganyan po yung itsura ng ating mga vaccination site. And our vaccination site fully complies with the National Vaccine Deployment Plan and other existing guidelines po. So gusto natin close coordination ties with the government para lahat ng nababakunahan sa Philippine Red Cross nare-register po sa National Vaccine Registry. So gusto natin highest quality of care, no? So gusto natin parang pag nandyan sila, masaya silang nasa Philippine Red Cross sila at di nila makakalimutan yung experience nila sa vaccination. Bakit po ganun? Kasi we want to make sure that through their experience, makakwento nila sa iba na ang sarap magpabakuna sa Philippine Red Cross, tara magpabakuna tayo. And that is our little contribution into promoting vaccine confidence here in our country. So tuloy-tuloy po yung paggawa namin, no? So meron kami sa Manila, sa Tarlac, sa Bulacan, at sa iba-iba pa pong lugar. Right now po, we are also deploying PRC vaccination teams to LGU-operated bakuna centers. Weekly po, meron kaming training, no? Para maturuan yung mga gustong mag-volunteer sa mga bakuna center. And we have actually been instrumental in making sure na yung mga underboard natin ng mga doctor, nurses, pag wala silang ginagawa, they help either as health education promoters at saka iba pong pwede pa nilang gawin sa bakuna center to support our licensed doctors and our licensed nurses. Through our strong volunteerism spirit po sa Philippine Red Cross, right now, 1,110 individuals po yung sabay-sabay na tumutulong to augment different LGUs po. So ito po yung sa Palawan, sa Marikina, sa San Pablo, sa Navotas, at sa iba pa pong lugar. Okay? And last po, we are currently deploying mobile vaccine clinics. I think ito po yung napapanood nyo recently sa mga news, no? And our goal is to deploy mobile vaccine clinics all over the Philippines. Right now po, we are actively operating sa Marikina, Mandaluyong, Navotas, Lapu-Lapu, and Mandaue City. Yes, yesterday po, we launched sa Batangas, Cavite, Laguna. And tomorrow po, maglo-launch kami sa Bulacan and Camanava area. So tuloy-tuloy po yung pagpapatakbo ng mga bakuna bus natin. Dahil ang gusto natin ilapit na po yung bakuna mismo sa mga bahay ng mga tao. Wala na pong rason para hindi magpabakuna. Yung mga senior citizen, hindi na po kailangan mamasahe. Yung mga PWD, pwede nang puntahan sa bahay through our mobile vaccination clinic. So ito po yung itsura niya. Sa Marikina po, ang ginagawa dyan, we deploy the mobile vaccination clinic in industrial areas. So yung mga arawan, yung mga contractual workers natin, yung mga pag nag-ECQ sila talaga yung tinatamaan dahil wala silang trabaho. We want to make sure that they're vaccinated. So we partner with industrial areas to make sure na babakunahan po sila. So pinapark lang natin to sa parking, lahat ng mga workers lalabas na babakunahan po natin sila. We also deploy this in Navotas. So sa Navotas naman po, naging storya dyan, sa Fisherman Port, no? So syempre buong araw nangingisda yung mga tao, ay hindi sila nakapagpabakuna. So inaabangan na po natin sila sa port. Tapos sa hapon hanggang gabi yung operations, pagdating po ng mga mangingisda, binabakunahan natin sila. So yan po. Sa Mandaluyong po, we deployed our mobile vaccination clinic in urban poor communities and also sa mga correctionals and jails po, no, to help vaccinate people deprived of liberties. So yung mga nakakulong po nating mga kasamahan na alam natin magiging focus yan ng infection pag may nagka-COVID sa kanila, binabakunahan din po natin kagad. Okay? So ito po yung sa mga Cebu chapter po namin. All of these services are concentrated in our 1158 hotline. So it's a one-stop shop for Red Cross COVID-19 services. So pag gusto niyo po magpabakuna, 1158 po yan. Gusto niyo magpatulong sa isolation, 1158 po yan. Gusto niyo magpa-test, 1158 po yan. And this was commissioned by Chairman Gordon po, Senator Gordon, dahil gusto niya hindi nalilito yung mga tao. Gusto niya, simple lang. Pag may problema, katawagan mo kami sa 1158. So do not hesitate to contact our hotline numbers kung meron po kaming maitutulong sa inyo. Marami pong, yung kwento po kasi ng pandemya, we know that it is a disaster. But we also want to, we are hoping that it will also be a story of hope. No? Gusto namin sana maging storya siya ng pag-asa. At gusto ko po sana kasama yung Philippine Red Cross sa storya ng bawat Pilipino kung paano po tayo babangon dito. Patapos na po yung oras ko, pero marami pa sana akong gusto ikwento. Gusto kong ikwento sa inyo kung paano kami tumutulong sa humanitarian relief. Pag nagkaka-ECQ, walang makain yung mga tao, tumutulong po kami dyan. Umiikot po yung mga disaster bus namin, di ba? Pag ngayong ECQ, namimigay po kami ng mga hot meals sa maraming tao. So, bumili po si Chairman Gordon ng 23 ngayon eh. Parang 23 na buses at food trucks umiikot ngayon sa Metro Manila right now that we have ECQ para po tulungan yung mga nagugutom. Nung nagkasunog po sa PGH, nandyan din po yung Philippine Red Cross. No? Nagpahiram kami ng fans, tumulong kami sa mga ambulansya at patuloy po kami tutulong sa Philippine General Hospital kung kakailanganin niyo po kami. At last po, we will continue to be a beacon of hope. Yung mga LSIs natin, yung mga hindi alam kung saan pupunta, we will continue to provide them assistance hanggang matapos po yung pandemya na to. Okay? Bago po ako magtapos, gusto ko sanang i-announce that the Philippine Red Cross will sponsor a bus visit po. So pupunta po kami sa UP Manila next week. So we have been in close coordination with the Chancellor's Office of UP Manila through Dr. Arlene Samaniego. So babakunahan din po namin yung mga frontline workers na hindi pa nababakunahan, mga support staff ng hospital, at mga health sciences faculty and administrators po na pasok po sa priority group para mabakunahan na din po nila. So pupunta po ang ating mobile vaccination bus sa UP Manila para bakunahan po kayo lahat at protektahan po kayo at ang inyong mga pamilya. So maraming salamat po. Sana po matapos po natin itong pandemya na magkakasama, walang magkakasakit at sana ligtas po kayong lahat. At sa dulo po, nandito po lagi ang Philippine Red Cross. We will always be first, we will always be ready, and we will always be there. Maraming salamat po.
Okay, thank you very much, Dr. Noel Bernardo. I don't know, I'm having another moment. Noel, I'm so proud of you. Ito yung mga parang in the future dapat mag-Secretary of Health, di ba? Nakikita nila yung complexity, anong kailangan gawin, and they have feel sort of like a sense of what people really need. I'd also like to just thank Mark Abrigo, who couldn't join us today. Actually, Noel, Mark has been also on the ground, helping with the hospitals and everything. And the whole team of the Red Cross, and of course, saludo po tayo kay Chairman Senator Richard Gordon for all the work that he's done. Nagka-COVID na, lahat na, pero andyan pa rin yung Red Cross. So maraming salamat, Noel. Okay, we're going to call everyone back in for a quick panel, and we're kind of running out of time, but we'll manage. So let's have Noel back, Felix, let's have Ted, Professor Cinch, and VP Neni Pernia. And I think Raymond's going to ask for the answers first or should we show the PSA first, Raymond? Ano ba?
Let's do the PSA, Dr. Susie.
Okay, so we have our usual campaign for vaccination. Let's go, TVUP.
O Apo, mukhang malalim yung iniisip mo, ha? Wala ka magpasok ngayon?
Wala po. May disinfection kasi sa grocery.
Ah, ganun ba? Eh di ba wala rin kayong pasok kahapon? Pati nung isang araw?
Sana makabalik na ako sa trabaho.
O siya. Di na muna kita istorbohin at mukhang malalim yung iniisip mo.
Look,
Ano?
magpabakuna na kaya tayo?
Walang problema, Apo. Paunahan mo lang ako eh. Talaga.
Dahil mahal ko kayo, magpapabakuna ako.
Okay, thank you very much, TVUP, for that public service announcement, and we'll keep on giving you those public service announcements just as part of our campaign for vaccination. So, Raymond, let's go to answering the questions that you put on our poll. Go ahead.
Thank you, Dr. Susie. But before that, we'd like to mention also that the COVID communication public service announcements are it's just one of the many outputs of UP study entitled Communicating COVID-19 in Post-Quarantine Philippines. The study is headed by our own VP for Public Affairs, Dr. Neni Pernia, and funded by the DOST, PCHRD, and the DOH through the AHEAD HSPR project. Okay, may we have the Menti? There we go. Okay, first question po. Ang Lambda variant is it a variant of interest, variant of concern, or a variant of high consequence? Marami pong nag-indicate na it's a variant of interest po. We'd like Dr. Saloma to reiterate lang po what she mentioned earlier.
So based on the WHO, the Lambda variant is a variant of interest.
Thank you so much, Dr. Saloma. And then for question number 2, ang Lambda variant ay inaakalang umpisa sa China, Brazil, UK, South Africa, or Peru. Most of our the respondents chose Peru. And the right answer po, Dr. Saloma?
Of course, Peru.
Okay, thank you po. Over to you, Dr. Susie. Let's start the ball rolling with the panel discussion.
Okay, thank you very much. So we have our panelists here. And I think, in the interest of time, Raymond, why don't we go to your upvoted question from the audience? Because all of the presentations were very, very clear. And I think I saw a number of interesting questions, but Raymond, what question did you choose?
So this question comes from Gabriel De Guzman, and I'd like to throw it to our NTF Special Advisor, Dr. Ted Herbosa. What are the current approaches being done by the LGUs now in light of what happened recently in several municipalities wherein there were huge crowds like in Las Piñas and other LGUs po, Dr. Ted?
Okay, the huge crowd that we're seeing were actually brought about by fake news, no? I think that happened because the government was lacking in anything. The policy is pre-registered people, pre-registration followed by going on your schedule once implicated. But there are, as I said, it's a complex emergency, and there are people out there out to make the government look bad. And in effect, they create super spreader events. The way those people actually on video stayed so close to each other, pushing and pulling, brings a lot of suspicion as to who generated such activity. And you all know who I'm talking about. But I think after that episode and then correction that there is no such thing as a vaccine passport that will disallow people who are not vaccinated from getting employed, calm down on people and people become. So again, very careful. No? This is an example of what fake news can do. It can drive us down to the turmoil and to more chaos. So make sure we get the correct information, verify facts, and then ask competent people.
O, tsaka I think, just to add to that, Ted, parang importante na yung frontliners natin, especially those who are listening to us now, are able to communicate the information to the public, no? Kasi actually, kahit anong gawin nyo, nakikinig sa inyong mga tao, no? So, malaki talagang puwersa ang frontliners natin against misinformation. Raymond, one more question, I think, because we're reaching the top of the hour. What do you have?
Yes, this one, we'll post it again to PGC Executive Director, Dr. Saloma. Dr. Saloma, so marami na pong variants coming in very rapidly. How confident is the government in terms of being able to keep up with the genomic sequencing work that needs to be done? But what with all of the variants coming in, Dr. Saloma?
So I'm very happy to share to you, Dr. Raymond, that the government has responded to the call of expanding our genomic surveillance capability. So before the end of the year, we hope to have a capability to do 350 a week in Visayas and also in Mindanao through the UP PGC network po. So nilabas na po ng DBM ang cheque kahapon, and we are now in the process of procurement, and that's really a very good news kasi we can do first for COVID, they will be able to have these next generation sequencing machines, and going forward po, hindi lang dito dahil nga core facility yung PGC sa Visayas at Mindanao, kahit po yung mga ibang cases even for, let's say, cancer transcriptomics and more complex genome sequencing analysis, may kapabilidad na po yung ating Visayas and Mindanao areas.
Wow, thank you very much. I think that's great news. And for the young ones who are listening to us now, you should all start studying biotechnology. Yan na yung mga bagong kailangan ng bansa natin. All right. I think, Raymond, we have to put our evaluation up, and then we're going to ask our panelists to just say a few words, their last few words to the audience. So let's go first to our evaluation, Raymond.
Thank you. This poll will show, at least for those who are in our Zoom webinar po, no, we are still numbering a little over 1,750. Will assess po your learnings and essentially the content that was delivered for this webinar. I'll read the following statements, and for those who are still in the Zoom call, please log in and your answers po, no? We are seeing nearly, or lagpas na po, 200 respondents for our fun poll, for our assessment, and we hope that there will be more than 1,700 still in the Zoom webinar to answer. The first statement: panelists demonstrated thorough knowledge of the topic. Second, the panelists were well prepared and organized. Third, the panelists spoke clearly and audibly. Fourth, the panelists used appropriate language with technical medical jargons to adequately explain. And number 5, the panelists contributed to new perspectives and knowledge on managing various key COVID-19 health issues. Dr. Susie?
Okay, thank you very much, Raymond. We're going to ask our panelists now to say a few words, very short. What are your parting words to our frontliners who are watching? So we're going to start first with Dr. Noel Bernardo.
Maraming salamat po pala sa pag-input ka sa Philippine Red Cross, no? Alam niyo po, tama si Doc Susie, pagod kami dito. Parang araw-araw kami BCB, marami kaming ginagawa. Pero yung mga ganitong mga webinars po, sobrang na-appreciate namin kasi nagkakaroon kami ng pagkakataon to correct the misconceptions of people about COVID. And also, on the part of Philippine Red Cross, we offer opportunities for people to contribute, na makatulong po. At bawat pong minuto na ginugugol namin dito, baka isang buhay yung naliligtas po namin. So maraming salamat po. Kami po sa Philippine Red Cross, ang gusto lang namin, may laban yung bawat Pilipino. Our duty is to alleviate human suffering, and we will always be there to help the Philippine government, and different partner groups po as they respond to this pandemic. Maraming salamat po.
Thank you very much, Dr. Noel Bernardo. Let's have Felix Dan Lopez. Felix, go ahead.
Sure. So earlier, perhaps as a parting message, earlier si Dr. Ted shared the 4 C's, no, of disaster recovery. I'd like to tweak that a bit and end with the 3 C's of how we can recover as one nation. The first one is really collaboration, which is part of the 4 C's earlier of Dr. Ted. No? The partnership, multi-sectoral partnership, really different groups reaching out together, joining together towards recovery. So that's the first one. Second, which I would like to put there, would really be clarity. I think we should be more intentional from the different sectors, the powers that be. I think we should be more clear in terms of the overall approach and strategy. But the last one, and which I think is the most important, the third C for me would have to be compassion or empathy or malasakit. I would always recall, no, I would always recall an adage. It says that if you want to lead yourself, then use your head. But if you want to lead others, then use your heart. So there, it's for me, it's really collaboration, clarity, and compassion, and this will definitely lead us to recovery. I salute all of the frontliners here, similar to the frontliners in Cebu Pacific. All of the frontliners in the call and those who are not in the call, we salute you and we thank you.
Thank you very much. That's Felix Dan Lopez of Cebu Pacific. Let's go to Dr. Ted Herbosa, the Special Advisor of the National Task Force Against COVID-19. Ted.
Thank you, Susie. I think my final words is really amplified by Dr. Noel Bernardo of the Red Cross, which is volunteerism and partnership brought about by the private sector. I think it is a time for our Filipinos to actually unite. Let us move together in solidarity. We are not in opposition with each other. Whatever your color is, we are still fighting the same enemy, and it is a virus. And if only we had more solidarity, I think we will be successful in fighting this pandemic. With that, I think thank you all really to Stop COVID Deaths for really bringing this information to the people, the clarity that you are able to do every Friday, and of course, the compassion to make sure that we save Filipino lives together. Thank you, Susie, and thank you to the team.
Thank you very much, Ted. We'd like to call on Professor Cynthia Saloma of the Philippine Genome Center. Prof. Cynthia, go ahead.
I would like to emphasize that if we have to recover in this pandemic as a nation, all hands of deck po talaga. No? So we bring to the table the talent of the Filipino, the best of our frontliners, the best of our policymakers, the best of the private and public sectors, our volunteers. As a nation, sama-sama po tayo, malalabanan po natin ito. And I'm very, very thankful to all our frontliners and to our communicators for bringing this effort to the public, because it's really, really important that we are united in our fight against this pandemic. Maraming salamat po.
Thank you very much. This is Professor Cynthia Saloma of the Philippine Genome Center. And last but not the least, our Vice President of the University of the Philippines, VP Neni Pernia. Neni.
Yes, thank you. I'd like to, very short lang, I'd like to add to what Dr. Cynthia Saloma said by saying that let us trust our scientists and let us applaud them, because we really do have the best in the world. And if we cooperate and if we stop listening to fake information and stop in the sharing of this, then we are really on the road to some kind of light after this COVID. Thank you.
Thank you very much. That's Neni Pernia, VP of the University of the Philippines. For our closing remarks, we have none other than the Dean of the UP College of Medicine, Dr. Charlotte Chiong. Charlotte, go ahead.
Thank you, Susie. First, I'd like to thank you for inviting me to give the closing remarks. It's been a very wonderful and very fruitful webinar number 66 for Stop COVID. We started off with VP Neni Pernia talking to us about the key information that will be important for COVID. And that will be, of course, being able to say that we need to be vigilant, to wear a mask, to be physically distant from each other, to be kind, to have good ventilation, to be able to deliver food and not be afraid that as long as we wash our hands, that children can be affected, that super spreaders can be around, and of course, that long COVID can be possible, and that fake news on social media really are inimical to public health campaigns, and that mutations will always happen, and that variants of concern or variants of interest will always be here with us, but bakuna is love. And therefore, according to Pope Francis, we should be able to survive this if we are able to show kindness to each other and compassion. Thank you to Professor Cynthia Saloma for her expert presentation. Now we understand a lot more about the Delta variant and, of course, the Lambda variant. And she presented us a really very important data on where it came from, this Lambda variant from Peru, and that although we have one case of Lambda variant in the Philippines, we are still not problematic like other countries, but therefore we have to still stick to the protocols, and that we need to be able to support our scientists, the Philippine Genome Center, and thanks to government for the additional upcoming support, we are able to mount a very good response in terms of being able to do surveillance of all the different variants for COVID. Dr. Of course, Ted Herbosa, our EVP, and of course, the one who actually is there to always welcome all the vaccines coming from all over the world, is here to show us that we are on track. October to November, we'll be able to ramp up even more from maybe 750,000 vaccinations per day, maybe 1 million per day is a target, and we should be able to mount a very good campaign so that we are able to reach the 70% of the population that's needed before we perhaps also look at boosters in the future and be able to go back to our new normal. And thanks, of course, to VP for Human Resources, Mr. Felix Dan Lopez, for showing us how Cebu Pacific as a company has really helped our country in our response to this pandemic, being able to transport all the vaccines from the different countries and also be able to transport these to the provinces, and show us how a private company can really partner with government in order to help the country and the Filipino people be able to surmount this virus. Thank you to our doctor to the barrio, Dr. Noel Bernardo, who gives us hope as a young doctor volunteering his services to the Philippine Red Cross. We have seen how the Philippine Red Cross has helped in so many ways, from testing to field hospitals to be able to bakuna centers and even mobile bakuna centers. And we will wait for you when you visit UP Manila to vaccinate the last few people who have not been vaccinated in our community here at UP. So it's very heartening that UP, we've been able to really help our country in so many ways. And also this Stop COVID webinar is an example of that. We continue to be hopeful because hope really is with us. And therefore, I'd like to echo the fact that, again, bakuna is love. We're proud to be Filipinos. Hope begins with all of us, all hands on deck. And I would like to say, from my end, kaya natin ito. Maraming salamat po.
Thank you very much. Again, very inspiring from none other than the Dean of the UP College of Medicine, Dr. Charlotte Chiong. Okay, so next week, before I say that, before going to next week, Raymond, we have someone in our audience who needs help for ano ba yung nakita ko, 98, 96-year-old. Maybe you can call 1158, or maybe you can put in the chat a message directly to Noel Bernardo so that you could be helped. No? So parang there's a patient who needs help. All right, so next week, don't miss it. We have, ganda ng topic natin, fully vaccinated na ako, bakit positive ako sa RT-PCR. So we are going to talk about breakthrough infections. And I think for many of you, for our health workers, this is an issue. You're vaccinated. I'm hearing from so many of my friends and from so many of our colleagues that our health workers are getting reinfected, but they're okay. Mild lang yung symptoms nila, pero nangyayari, no? So we are going to focus on you. We're going to talk about breakthrough infections and what we can do so that we can prevent this. We've heard a lot about the prevention, but we will tackle breakthrough infections. Okay, over to you, Raymond.
Thank you, Dr. Susie, and thank you for that excellent wind-up po for and synthesis from the Dean of the UP College of Medicine, Dean Charlotte Chiong. Before we conclude our program, we'd like to acknowledge first the very hardworking team behind the Stop COVID Deaths webinar series. This webinar series will not be possible without each and every one of you. So maraming salamat po sa inyong lahat. And then finally, all of our webinars po, no? All of our episodes, all 65 and thereafter, after this webinar, we will also be archiving all of our webinars from 1 to 66, including this one, after this episode po. So please tune in and log in po sa www.youtube.com. You look for the TVUP channel and you'll be able to see all 66 episodes for our webinar series. So this brings our webinar today, at least for today po, formally to a close. We look forward to each and every one of you being able to join us during our regular Friday lunch date from 12 noon to 2 p.m. It's a date.
Together, we can stop COVID deaths.
So keep safe, keep healthy, and see you online.
The enemy remains unseen. I'll keep your hand in mine. Let's say a prayer one more time. I know you long for home, but I am here, you're not alone. I'll stay with you until the coast is clear. The others pain before my fears, the others love before my tears. But right behind the mask, I look into myself and ask, do I have strength to carry on? My God, how long must this go on? I need you here to keep me strong. I'm here to hold the line. I'll keep my word until my time. Look into my eyes and say his name to realize it's fine to be afraid. Just hold on to the word he gave. This time will come to pass, 'cause this salvation's made to last. He'll carry you to see the break of day. The others pain before my fears, the others vows before my tears. But right behind the mask, I look into myself and ask, do I have strength to carry on? My God, how long must this go on? I need you here to keep me strong. I'm here to hold the line. I'll keep my word until my time. The others pain before my fears, the others loves before my tears. But right behind the mask, I look into myself and ask, do I have strength to carry on? My God, how long must this go on? I need you here to keep me strong. I'll keep my word, your word is mine. The others pain before my fears, pushing on despite the tears. Please take us through another day. Just hold my hand, and I will hold the line. I will hold the